All right, it is 12:35, so we'll go ahead and get started. Just so that everyone knows, this session is being recorded. However, your names and cameras are not on. So all that will be shown is the panelists and the slide deck. We do this for anyone that is not able to attend, and we post those recordings on our website, impilo.health, for your review after the session. So if you're interested in reviewing anything that we discussed today or sharing it with any colleagues or anyone in your network that may find it valuable, you'll be able to find it there as well as in a follow-up email after this call. Super excited that you all joined us today, so let's jump right into it. We're very excited to be talking about the next generation of EHR with our very special guest, Marcus and Nick from Healthie. So a little bit about Impilo. We love to say our main saying of what we do is you handle the clinical side and we handle your operational side of your remote patient monitoring program. So Impilo was built to simplify your remote patient monitoring program. Ultimately, we are an integrated device portal that supports logistics, customer support, and we also offer customer-facing and patient-facing APIs to ensure that your entire patient experience is very seamless. We're able to operationalize our customers' clinical patient programs with integrated medical devices and tailor it specifically to their needs. So a little bit about our customers at Impilo. We deal with all businesses from private practice to digital health to major health networks, and we work across all healthcare sectors, which is why we are so incredibly excited to be working with Healthie today. Obviously, they are a parallel in the space, helping many providers from private practice to digital health and major health networks connect with their patients as well. But we're very excited to welcome our panelist, Nick from Healthie. He is the director of the marketplace, which is called The Harbor, and he is formerly from Panda Health and Mend. But Nick, if you want to further explain yourself, go ahead.
Yep. Thanks everyone for joining. So as Haley mentioned, my current role is the director of marketplace at Healthie. So really any technology or service partners that Healthie works with to better serve our customers really falls under our marketplace that we rebranded to be called The Harbor. We have now over 36 companies that are in our harbor, and it's growing more every month. And it really helps us serve our customers better by adding solutions that Healthie's not going to be able to develop ourselves at the pace that our customers want us to. So we're super proud to have companies like Impilo, ranging all the way to scheduling companies and others in there as well. My background is actually in a mixture of different areas in digital health. At Panda, I did consulting for health systems and a variety of digital health tools. And then at Mend, I was actually on the other side of the EHR marketplace, where I was a patient engagement platform getting into EHR marketplaces like Athena and others. So I'm super glad to have that perspective from varying routes and now being on this side growing Healthie's marketplace.
Awesome. Thank you, Nick. And as some of you may notice, we have another guest on the call. Marcus is the customer success manager over at Healthie, who is generous enough to help us today and is happy to answer any of your questions in the chat. But Marcus, if you want to go ahead and introduce yourself.
Yeah, thanks, Haley. Thanks everyone for joining today. Really excited to be here. Slight correction to what Haley said. I'm actually our partner success manager. But very similar or parallel roles to what you know as a customer success manager. I work alongside Nick here with our marketplace partners. All the partners that Nick had mentioned are the ones that I work directly with, and also thrilled to be working very closely with Impilo and Haley and the team. My background is actually, I started outside of digital health. I started with working with Apple, more specifically with Apple Pay and API business development there, working with online merchants, but always had passion for healthcare. So I made that switch and moving on to Next Health, which was a patient engagement platform that integrated with health record systems. And now I'm on the other side, working on the EHR and our integration partners. So plenty of knowledge around the integration side, but really excited to be working with a wide variety of integration partners and talking about why digital health is the future.
Awesome. Thank you, Marcus. Super excited to have Healthie on the call today and to introduce myself. My name is Haley Minter. I am our marketing and demand generation lead here at Impilo. Super excited to chat all things about EHRs, from the traditional EHR all the way to the API-first EHR. So let's jump right into it. So as I mentioned, obviously there has been a long evolution of EHRs, from traditional EHRs to the API-first EHRs. Nick, obviously, Healthie is a more modern EHR, has some capabilities that our traditional EHR doesn't. So can you elaborate a little bit on the traditional EHR and kind of the process of why it evolved into what it is today?
Yeah, and so I think it helps with context of really what makes an API-first EHR different, or why even put that term in front of EHR. At Healthie, we have a GraphQL API that really has 100% coverage of the fields that you might find within Healthie. When I was working at Mend 6 years ago, and we were that bolt-on trying to integrate into different EHRs, even just as short as that time period of 6 years ago, it was always whether we were going to win or lose a deal was based on the EHR that the potential customer was working at, because we didn't know what the integration capability was going to be at that time. And I think over the past 5-10 years, we've seen a big mix from just the on-premise EHRs to now the more cloud-based EHRs. And even in that transition, some companies really kept their cloud-based EHR closed off from allowing third parties to do that integration work, or even giving customers the ability to do a lot of their own customization on top of it. And so in this transition to being API first, we're seeing many more platforms not just allow their customers access to the API to really be able to customize it, but also to third parties that their customers may want to be able to work with.
Awesome. Thanks for that information, Nick. So like Nick said, obviously customization is something that wasn't accustomed to traditional EHRs, but as we live in a personalized and customized world, obviously our healthcare systems and platforms have to adapt as well, which is why the API-first EHR may be the right choice for your business if you're continuing to want to adapt and scale with the changing landscape of healthcare. But a little context about API-first EHRs and why their capabilities matter are they have seamless data capabilities, allowing the data to flow, like Nick said, between multiple systems, but having that be customized. So not only does this reduce errors, but it ensures that providers have the most up-to-date information at all times. And obviously that is critical for delivering high quality information in a high-stake environment. So providers looking to really get real-time data access, an API-first EHR may be a potential solution for your business. Like I mentioned, real-time updates, Nick, I'm sure you could speak to this as well, but real-time updates are vital within the healthcare field. Remote patient monitoring has come into the space as a tool to have increased visibility to data in real time, but the API-first EHR is really what is making it all work. So that is another aspect of the API-first EHR that may be an advantage for your business. And then also to patient access. Like Nick mentioned, that customization, something that is becoming more prevalent in the healthcare space is the ability to also reflect that data to the patient. As a healthcare patient myself, I always love being able to see what my doctor's seeing. Knowledge is power. So by being able to integrate information between EHRs and patient portals, patients are able to access that data more easily, empowering them to be an advocate on their healthcare journey. And the last thing about API-first EHRs that your business may be able to leverage is the flexibility. You're able to add new features and customize continuously without having to disrupt any workflows, and you're able to ensure continuous improvement and adaptability. And that adaptability makes it easy to have new tools as they come up and are introduced into the space, and allow your business to stay competitive without causing any downtime or disruption into your current internal processes. Nick, is there any high-level thing that you'd like to mention before we move on to some of the advantages of the API-first EHR?
I think two of the things you mentioned that are great are the ability to give the patient access to their data and that customization as well. I think one of the great things that we've seen with Healthie's API is even though we have our own patient portal, just like many other EHRs do, we have a number of customers that have actually been able to build their own patient portal as well. And because we're an API-first EHR, any of the data that they might want to make available to patients, they're able to do so in real time.
Awesome. And Impilo feels the same way. We are all for customization and personalization and also offer an API documentation. So there's many companies that are supporting the initiative of the API-first EHR and swaying away from the difficulties of integrating to a traditional EHR. But if we go into some of the advantages on a high level, the main 6 advantages would be interoperability, scalability and flexibility, patient engagement, innovation, and efficiency. So we'll speak a little bit to each of those points, but first would be the interoperability point of the API-first EHRs. And this is extremely important as it ensures that various systems can communicate and share information between one another, which is essential for coordinated care and efficient operations. Nick, I know that Healthie has a phenomenal blog about the API-first EHR and does touch a little bit about interoperability. So if you could speak to that, I'm sure our viewers would love to hear it.
Yeah, I think between terms like interoperability and integration, it kind of goes hand in hand with that second advantage of flexibility. Oftentimes, you hear one of patients' pain points are how many times do they have to walk into a doctor's office and fill out the same forms again and again? And maybe it's because they did it at their therapist's office last week, an urgent care a month ago, and now next week they have their primary care appointment and they're going to be doing the same thing again. I think a lot of the interoperability tools that are out there now that are able to give organizations access to some of that patient data through interoperability tools like Zeus, who is in our harbor, has been amazing. And with API-first EHRs, we're not just locking our customers into the interoperability solutions that we have partnerships with. If there's maybe a specific niche platform that they need to be able to partner with, we're able to open up to that. They can build the integration to those tools to make sure they have access to all of the data that they need to.
Awesome. And speaking to that point, obviously allowing access, which is part of the flexibility piece of API-first EHRs and the scalability. So as we all know, life moves very quickly, and I could speak for myself that we are working in and out of different platforms every day and switching from one to another almost month over month. So it is important to have a platform to be nimble in. So as your business continues to grow, it's something to take into consideration with your EHR. Is it something that is easy to customize and grow with your business as your business ebbs and flows? But one of my favorite parts of why I find API-first EHRs so fascinating and such a game changer in the space are its capabilities for patient engagement, ultimately enhancing patient care. So I'm sure all of us have been patients at one point, and we have had good and bad experience in the healthcare space. But something that the API-first EHR is doing that is kind of putting the patient in a position of power, like I said earlier, is giving them access to that knowledge and also very quickly. So by having the data aggregated onto the platform in real time, the provider can tell the patient that data in real time as well, leading to quicker decisions, quicker treatment plans, ultimately allowing the patient to have a better healthcare journey overall. But another aspect of API-first EHRs are the efficiency. Obviously, in this space, we are dealing with humans, so there can often be human error, and the API-first EHR reduces the need for manual entry errors and administrative burden that leads to overall more efficient operations. When you have more efficient operations and less time spent on administrative tasks, you're able to focus on your number one priority, which is the and the last part about the API-first EHRs that may be an advantage for your business is the innovation that it brings. As the landscape continues to evolve, new platforms are going to arise. And like Nick said, having the ability to integrate them and customize them on your own terms will really put your business at the competitive advantage to continue to provide your patients the best care. But Nick, if you could speak to any more of the innovation, kind of the evolution from how we started with traditional EHRs to where we are now and potentially where you see it going in the future.
Yeah, when EHRs first came out, it was mostly buy was the solution, and probably an on-prem solution where there wasn't a whole lot of ability to go in and do that like third-party customization that you need to it. At Healthie, we now really focus on the term of, well, buy and build. And API-first EHRs really allow you to do that in ways that other EHRs don't. And it rings both true for innovation and the scalability. There's a number of customers that come to us. They use Healthie out of the box, our user interface, our user experience. They grow from 5 clinicians to 500, and then they move forward with the API access. They're building in third-party tools to be able to better serve their large clinician network and their network of patients. And on the innovation piece, I think, EHRs are never going to be able to handle 100% of the tech stack that a lot of these organizations require. I mean, whether you're a health system with 400 plus digital health contracts or an FQHC with your EHR and maybe 10 to 20 additional contracts, being able to make sure that those third parties integrate in a way where you're actually moving discrete data is where the value in integration lies. I remember countless integration conversations where we're just talking about pushing PDFs back in, and that's great to solve that piece, but then when you're going in, reading that PDF and moving over 20 data objects into that patient's chart, it still takes up that time, and it adds in an ability for human error when you're doing that manual copying over. And so the ability that the API gives you to do the discrete data movement is super powerful. And I think AI is just another area, and I almost hate to bring up AI because it's such a buzzword, but there's so many companies now that have created really amazing AI co-pilots for clinicians to either write their chart notes or really great QA tools to help train staff and clinicians on their workflows and their times with patients, where it gives the opportunity for EHRs like Healthie to really focus on areas where we are the best at and where our customers are asking us to focus, and then let the third parties focus on the solutions that they're building that really do take entire companies to build and do it right.
Awesome, Nick. Great points there. Love that you spoke to the builder buy. Obviously, I'm sure that it is a big thought in people's heads when they are approaching an EHR or integrating any other system. But to jump into some use cases of these EHRs, and I can speak to a couple, and Nick would love your thoughts on others. But first and foremost would be the remote patient monitoring space or the virtual care space, which is what Impilo primarily focuses on. So obviously remote patient monitoring is newer in the space, really boomed during the COVID pandemic for a vast majority of reasons, but primarily to increase quality of care without having any human interaction. And luckily for us, we've noticed the benefits that remote patient monitoring has brought, and it has stuck around and has continued to evolve and grow into a more traditional healthcare approach. But remote patient monitoring with API-first EHRs are perfect for each other because they are just crucial to ensuring that they're getting timely and accurate data flow, which is the main priority of remote patient monitoring, getting the data from the connected device into the cloud, into the provider within seconds. But API-first EHRs also have the benefit with remote patient monitoring because there's many different platforms and devices that need to be integrated into these systems in order for the data to aggregate. So with the ability of the API, you have a user-friendly experience that really allows you and your business to work with multiple devices through multiple manufacturers, allowing you to provide a very well-rounded experience and offering to your patients to ensure that they're getting the care that they need. But obviously, when we're dealing with EHRs, many different practices and ways of care come into play. Some of those would deal with telehealth integration, behavioral health as well. And then we also deal a little bit with insurance and billing. But to touch on the telehealth integration, telehealth is also something that has become more prevalent within the past couple years. And I'm sure Nick can speak to some of the customers on the marketplace that are within the telehealth space. but telehealth has definitely leveraged the advantages of API as well with all of the integrations of various platforms. But Nick, if you want to speak to any of your customers on hardware.
Yeah, I really look at the integrations that we have in kind of three different categories. You have the solutions that are primarily built for things prior to the appointment. Often those are scheduling tools like ZocDoc that we're launching an integration with soon, or it's intake forms to making sure you're getting all of the patient information you need prior to the visit, or even things like running eligibility checks, getting the patient's insurance. Then the second category is actually that point of care. It's during the appointment or even when the patient's outside of the home and they're doing remote patient monitoring. It's getting that data from the number of devices that patient might need to be using. And then finally, you have, well, after the appointment or after that immediate point of care, and that's where you get things like billing integrations coming into play. And those are really the three areas that we look at it. And what we've seen really makes the API first integrations that much more valuable, and also the ability for us to offer webhooks is we've been able to allow a lot of our partners and our customers to create almost business rules by using the webhooks, or either creating triggers based off of information that they get via the API that allows them to go then take the next actions they need to. This is almost like a sweet spot of one of our partners, AWell, as well, where they're taking in the data from Healthie, and then you can build a whole flow on top of that as to what you need to do next. And a partnership with Impilo makes something like that even more powerful, because when you get a reading from a patient that gets sent back into your EHR, and maybe the reading is outside of the normal scope, that can then allow an additional trigger to go off on maybe a provider needs to reach out to that patient immediately, or you need to trigger some other second action to happen.
Awesome, Nick. Love that you mentioned the triggers. Obviously, when you're dealing with any type of care and devices and chronic conditions, emergencies can arise. So having that ability to have the real-time data and have those triggers and alarm trees set up so that the provider can really trigger their care tree and provide the best treatment plan for the patient is just simply amazing. And then that also plays into effect for things such as behavioral health, obviously a topic and area of healthcare that is very timely and needs to be taken very seriously. So the API first EHR, like you said, can set up those triggers that ultimately can be life-saving and change an entire experience for a patient. But we talked a little bit about the use cases and advantages of API first EHR. So we wanted to talk about a real life scenario. So Nick and his team at Healthie deal with a plethora of companies that are doing phenomenal things in this space. But one of the companies that they are working with is Kaya, and we wanted to speak a little bit to that. So Nick, if you want to kick it off.
Yeah, I think Kaya is a great example of a customer on Healthie that really used the advantages that an API first EHR brings. You can see here one of the big things that happen with, and the pain points of picking an EHR comes with that action of migrating off of that old EHR. And if you have a platform where basically 100% of the fields are not just read, but also you can write to them via the API, that makes the data migration extremely more powerful, depending on how you're able to get the data out of your old system. And you can see here, Kaya was able to launch in just 2 weeks on Healthie and take advantage of a lot of the provider and clinician-facing tools that we had, while then using our API to make sure that they were connecting to some of Kaya's proprietary patient-facing tools that they had. Now, in a system that might have been more closed off, creating that seamless provider-patient experience may have been much more difficult, require many more engineering resources. And so we're super proud to have Kaya on board. They're one of the largest MSK providers in the space. And I think it goes to show that when you have customers that have the engineering teams that are able to do this customization and take advantage of the API, it's not just cool tech, it's actually bringing a lot of unique things to patient care that otherwise aren't available. And you can see here, I mean, just the image here of the data points that we're looking at on the individual isn't technology that Healthie brings to the table. And so by them being able to partner with us, making sure that they're using these video visit technologies where then the data enters back into Healthie, is just a really cool example of how a platform like Healthie can serve a MSK company and all the proprietary needs that Kaya brings, and then also a really large mental health organization, and serve both of those very different specialties in a way that works for both organizations.
Awesome, Nick. Thank you for sharing. That is a phenomenal real life scenario of something between Healthie and integrating into Kaya. And what Kaya is doing is also phenomenal. And we love to see that Healthie is helping market these businesses on their marketplace, the Harbor, as well. But obviously, if we are talking about all things EHRs, we do want to talk about the challenges of some of the traditional EHRs that you may see, and just speaking to the advantages of the API-first EHRs, why you may want to leverage one or the other. But some challenges that you can face if you are dealing with a traditional EHR, similar to Kaya, is that you're going to have to one day integrate into another system if that's something you're looking to do. So you face the issue of data security. You always want to ensure that your patient data is secure for a large majority of reasons, but primarily to stay in alignment with HIPAA compliance. And data breaches are costly and really damage a company's reputation. So by implementing the API-first EHR, you can offer enhanced security that protects all of your sensitive information. And what Nick mentioned earlier with the webhooks that can be used, you can also further enhance that level of security as well. Like we touched on earlier, traditional EHRs have interoperability standards that are difficult to work with. So your API-first EHR, like we've been speaking to, may be easier to integrate to and continue to customize as your business continues to scale and grow. Like I mentioned previously, that HIPAA compliance is of main priority. I'm sure Nick could speak to this as well. EHRs hold a whole ecosystem of patient data that we want to hold very closely to our organization and our trusted colleagues to make sure that that patient data is protected. But lastly, the integrity of that data, making sure that it is quality and correct so that you are able to provide treatment plans to your patients that are in line with their conditions and all of their data that is aggregating into your system. But Nick, I'm sure you could speak a little bit to the challenges that you have seen dealing with integrations from traditional EHRs to the API-first EHRs. So I would love if you could touch a little bit on the challenges that you have seen with some of the providers and companies that you have worked with.
Yeah, back when I was at the patient engagement company, when we were working with an EHR that may have served a community mental health center or an FQHC, the timeline just to do an integration to a video visit platform could have been anywhere from 2 to 4 months, depending on just the level of data that we were moving back and forth, how much, again, was discrete versus PDFs, or really just even getting access to that specific instance of that customer's account of whatever EHR that they were using. On Healthie, we have a number of processes and procedures in place to make sure we are sharing the API access in a very secure manner, but we're able to do so in a way where when a customer signs a contract with a third party, in as little as 24 to 48 hours, that third party can be building an integration to that customer's account where it's really speeding up the time to value and the ROI that a lot of these third-party solutions are promising. And it's almost a pro and a con to have a GraphQL API at Healthie. I was literally on a call with a partner last week, and it's an engineer's first time using GraphQL in a healthcare integration. And so I think that's one of the things that we do see, when an engineer may have been in healthcare for the past 20 years, they're typically doing integrations maybe via HL7, that GraphQL is new. So it's still something that at Healthie, we see there's a lot more room where healthcare can continue to become more and more API first and use a variety of APIs.
Awesome. Thanks for sharing, Nick. I think the theme that we're seeing here is API-first EHRs really allow companies to be nimble in the space and continue to innovate by also allowing their processes to be flexible in real time and just ultimately enhance their patient care. But some solutions going off of that, that the API-first EHRs bring. Like Nick mentioned, the data integration is of utmost priority if you're dealing with engineers. Just having the API documentation makes it significantly easier to integrate into systems. And like Nick mentioned, it's as simple as signing a form, and the next day your engineers would be allowed into the platform to start customizing your integration. Like we've mentioned, I feel like 1,000 times over this webinar, is the main value is the real-time data access in a high-stake environment. It's crucial to have that information, and you can ultimately save a life. And then the scalability of the infrastructure, like Nick mentioned, the ability to do things you wouldn't be able to do elsewhere or with any other traditional EHR. I think what's so great about the API-first EHRs are they are continuing to innovate, like Nick said, with the H7 and everything of that regard. You're kind of able to shift the traditional norms and continue to grow into the space. But Nick, just want you to touch a little bit on the enhanced patient engagement, obviously, because you are talking to a lot more providers than we do here internally at Impilo. Can you speak to any stories that your customers or anyone in your network has shared about positive patient engagement or experiences due to an API-first EHR?
Yeah, I think patient engagement can mean two different items. It can mean outside of the point of care, where patient engagement's really about increasing compliance with patients even getting to their appointments. And then you have the more clinical side of patient engagement, where maybe that patient has a diagnosis and how you're engaging them in between appointments. And I think that's where allowing specialty specific third-party solutions is extremely valuable in improving the quality of care that a patient is getting. Where at Healthie, again, we have everyone from nutritionists and dietitians, therapists and psychiatrists, physical therapists, primary care docs, where a patient might be being seen on Healthie for any number of reasons. And nutrition is actually one of our largest specialties. And there's so many food as medicine tools that are out there now that are using AI to create like a whole myriad of recipes for patients based off of their preferences and their recommendations from a dietitian. And so that's one of the areas where patient engagement is now not just about like, how do we make better reminders, but when a third-party tool is really able to get like that type of data out from the EHR to inform how to either make better recipes, you're doing medically tailored meals. I think it's a great example of making that data supercharged for patient care.
Awesome. I love that you touched on the food as medicine, because one of our customers here at Impilo, Arkansas Rural Health Partnership, is doing a phenomenal initiative with their RPM program called the Good Food RX, which is all focused about using connected devices to monitor chronic weight conditions and really enhance nutrition in areas that may be limited to resources to healthy food. We actually just wrote a white paper on that. It is available on our website for review. Super neat what they're doing over there, and speaks to what Nick mentioned about the patient engagement aspect of how the API-first EHR really just ties in the whole experience of making sure the patient is receiving quality care, both in the care facility and outside of the care facility. But enough about API-first EHRs and Impilo. We would love to give our special guests a chance to share a little bit more about their business. Obviously, Nick shared a little bit about Healthie, but would love for you to explain all that Healthie is doing and a little bit about the Harbor Marketplace.
Yeah, awesome. And I'll try to keep it short so we're not just talking about Healthie too much. But I think the saying here is really, Healthie's ethos of powering healthcare outside of the hospital. Healthie is a EHR scheduling and patient engagement platform for really those outpatient virtual care and really those long-term relationship with patients type of settings. So we have everyone from nutrition and dietitians, mental health organizations, MSK, women's health, and so on, ranging from practices as small as a solo provider, maybe coming out of school and getting right into treating patients on their own for the first time, all the way up to organizations that have clinician networks into the thousands And I think one of the really unique things about Healthie, because we are API first, is we're able to support customers with so many different business models. So we have everyone from women's health organizations that are partnering with OBGYN practices and doing collaborative care, to mental health organizations that partner with employers or partner with universities, all the way to organizations that really are just providing that direct to consumer care. So you'll really find those types of specialties on Healthie, and that's really where we kind of do best, is when you think of that like wellness theme overall.
Awesome. Thanks for sharing, and we greatly appreciate you guys jumping on the webinar today, Nick and Marcus. Nick, your insights were very knowledgeable, and I'm sure our attendees would say the same. But we'd like to open it up now for a Q&A session. Attendees, feel free to drop any questions in the chat, whether that be about Impilo or Healthie, about traditional EHRs versus API-first EHRs, or anything we touched in the presentation. Just make sure that when you are writing in the chat that you are writing it to either myself or everyone, so that we are able to answer your question. And if we're unable to get to it on the call, we will surely follow up after the call. All right, it seems that we are having a technical issue with the questions, and I am getting notes that only myself is able to be messaged to. So if you have any questions, feel free to message them to me, and I will be sure to answer after the call. We sincerely apologize for the tech issues, but in the world of technology, it is just the norm that sometimes happens, but we will surely be able to follow up with you after the call. But with that, we will wrap here. Thank you again, Nick and Marcus, and the entire team at Healthie for their collaboration for this webinar. We hope that everyone that attended was able to take something away from this. As always, these sessions are recorded and they will be sent out via email, as well as live on the Impilo website, which is linked on this slide. But if you have any questions for myself, Nick, or Marcus, feel free to relay those to marketing@impilo.health, and I'll be sure to relay that on to the Healthie team as well. But thank you again for joining us. We have webinars monthly, so please join us next month, and we are excited to see you then. Until then, thanks for joining and have a great rest of your day.
Thank you.
Thanks for having us, Haley.
Thank you guys. Have a good one.